This research is really important because it starts to be able to tell us how much is spent on community care. This is really important to us at Marie Curie, who provide community nursing services, and it starts to show the potential benefits of these services in terms of cost savings. Marie Curie are committed to looking after more terminally ill people and contributing as much as we possibly can. But we know that this is a time of austerity, and there's also increasing need with the ageing population. So being able to demonstrate some potential savings is really important, and that's why this research is so important to us. We commissioned this research on the back of some work that we'd done in the past. That was looking at the impact of our Marie Curie nursing service on the care of 30,000 people, matched with 30,000 who didn't receive the nursing service, which demonstrated that those people who we cared for were far less likely to use accident, emergency and hospital services generally. We recognised at the time that, of course, there was the possibility that that might save the NHS money, but we weren't able to demonstrate it because there's always the possibility that the costs are shifted out of the hospital into the community. So this second piece of research was commissioned from Nuffield, asking them to look to see whether they could quantify the cost of people being in the community, looked after more by district nurses and GPs and by services such as our Marie Curie nursing service, and whether that would actually save money. Why that's important to us as an organisation is that we know that people don't want to be in hospital. So we're committed to trying to help people stay out of hospital. So it fulfills that requirement as well, because if we can demonstrate to the NHS and commissioners in particular that people are able to stay out of hospital with our services, which is what the first piece of Nuffield work demonstrated, and that it actually reduces costs, that's good for patients and good for the financial situation we find ourselves in. The key findings of this research was to show that it was more cost effective to keep people out of hospital. So even taking into account social care, district nurses, primary care including GPs, as well as the support services that organisations like Marie Curie provide in terms of a nursing service, there is still the potential to save on average £500 per patient in comparison with them needing to go into hospital. We think this is really important to commissioners. Commissioners are obviously at the moment trying to work out how to provide the very best possible care for their population, but in the most cost-effective way. And this seems to me to be very important that we've got these findings at this particular time, because this should be able to help them make the right decisions in terms of what people actually want for themselves and their loved ones, and the right decisions in terms of what is the most effective use of their money. So having the potential to save about £500 on each person must make sense to them, and we hope that they will really consider using services such as our Marie Curie nursing service and similar services provided by others.